It's an inevitable part of the aging process, affecting more than 27 million men over the age of 50 each year in the United States. Benign Prostatic Hyperplasia, BPH, better known as enlarged prostate, is one of the most common conditions among aging men, affecting half between the ages of 51 and 60 and 90% of men over the age of 80. Enlarged prostate can cause a multitude of symptoms and disruption to a man's daily life, but no one knows exactly why the condition occurs.
BPH is the benign or non-cancerous enlargement of the prostate. So with age and time, the prostate in any man will grow. And as it grows, it begins to constrict. And as it constricts, sort of like a vice around a garden hose, it causes the bladder to have to work harder and harder to get the urine out. And because it's working harder and harder, it gets sort of irritated. And then men begin to experience symptoms such as the classic urinary urgency, frequency of urination. The man might notice that they're waking up more times at night, disrupting their sleep. As it progresses, they'll start to notice that they're pushing harder to get the urine out, straining to urinate, feeling like they're incompletely emptying their bladder. Even in the more extreme circumstance, they can have urinary retention where they can't even empty their bladder at all, and they have to rush to the emergency room to have a tube placed into the bladder to drain the bladder. Additionally, as BPH progresses, men can get what's known as hydronephrosis, which is the backup of urine into the kidneys. The kidneys begin to swell, and their function begins to decline because of that. So there are many different consequences that are negative from having an enlarged prostate.
And although enlarged prostate is not life-threatening, up to 95% of men with moderate symptoms report they are unhappy and do not want to spend the rest of their lives this way. Harvey Moskowitz experienced symptoms of BPH and decreased quality of life for 5 years before he finally sought treatment.
I had BPH for about 4 or 5 years. It was really very inconvenient. It was interrupting a lot of my normal activities. I'd have to stop and make time for the bathroom. And eventually I got to the point where I couldn't urinate at all, and I had to use a catheter for about 2 or 3 months. And that's when things reached a head and I knew I had to do something.
When it came time for treatment, Harvey's doctor recommended a minimally invasive option called GreenLight laser therapy. Unlike traditional surgical methods, GreenLight laser therapy uses laser light to vaporize excess prostate tissue. Performed on an outpatient basis, this innovative therapy delivers faster recovery, less bleeding, fewer serious adverse events, and lower overall hospital costs as compared to traditional surgery.
GreenLight laser therapy is an innovative technology where the urologist will introduce a camera into the urethra, which allows them to visualize the prostate from the inside. And what they do is they introduce a small fiber through the camera, and the fiber introduces a laser. The laser heats up the prostate tissue and causes the tissue to actually vaporize. And this removes all the excess tissue, which allows the prostate channel to open up so that the urine can flow through better. The beauty of the laser as compared to traditional therapies is that the laser, as it vaporizes and opens up the tissue, it also seals the blood vessels so that there's minimal bleeding during the procedure. The surgeon can then visualize what he's doing better and more carefully construct the channel so that the urine really will flow out in a maximally effective way.
Post-treatment, most patients say they experience rapid relief of BPH symptoms and improvement of urine flow after the procedure. Additionally, over 94% of men report being satisfied with the treatment and say they would recommend it to others.
The GreenLight laser surgery was a wonderful procedure. It just returned me to my normal life before I had any difficulty. I was able to urinate at a normal level. There was no pain, no discomfort. It was like nothing ever happened to me. It was just like I got my life back in a sense.
Right after the laser treatment, I feel relief instantly. No more pain, no more suffering, no more anything. I just live. I will highly recommend this to anybody, because that's the best way to go. When you finish that, it's just like it never existed before. You never had that problem before.
Right after the procedure, I couldn't believe how comfortable I was. I was back at my desk in the office, the next day with no discomfort, like I had nothing done except that I had had all this relief. The amazing thing to me is that I had the old traditional procedure many years ago, and now with the new technology, having this GreenLight laser procedure is fantastic, and it's something I would highly recommend to anybody that needs this kind of therapy.
With more than 700,000 patients treated worldwide, GreenLight laser therapy is a proven, cost-effective solution that doesn't require the use of ongoing BPH medication for men diagnosed with enlarged prostate. As with any surgical procedure, there are risks that should be discussed with your doctor.
As with all surgical procedures, there are risks of a GreenLight laser just like any other procedure. But men with enlarged prostate should understand that the GreenLight laser therapy is available. As compared to the traditional methods of treatment, GreenLight laser therapy allows men with enlarged prostates who require surgical therapy to have relief of their symptoms through a minimally invasive outpatient therapy. There's decreased need for a catheter after the surgery. There's certainly less blood loss associated with the GreenLight laser. And right away they're experiencing increased urinary flow. They're waking up less at night. They're having less urgency and frequency of urination. And overall just their quality of life is improved. And that, as a physician, nothing can make me happier than just to see that my patients are satisfied with the results of an intervention that I've recommended to them.
To learn more and find a physician who offers GreenLight laser therapy to treat your enlarged prostate, please visit treatmybph.com.